Welcome. Today, we'll walk you through how to read a lab report for an HPV test. Understanding your HPV lab results can feel overwhelming, but with a clear explanation, you'll know exactly what to look for. Whether you're reviewing your own report or helping someone else, this guide will break down the key sections, terminology, and what the results mean for your health. Let's start by understanding what an HPV test is and why it's important. HPV, or human papillomavirus, is a common virus linked to cervical and other cancers. Early detection through testing is crucial for prevention and treatment. HPV stands for human papillomavirus, a group of related viruses. Some types of HPV can cause health problems like genital warts and cancers. Most HPV infections go away on their own, but persistent infections with high-risk types can lead to serious health issues. The HPV test checks for the presence of high-risk HPV types in cervical cells. Understanding this helps you see why the test is so important, especially for women over 30 or those with abnormal Pap results. The main purpose of the HPV test is to detect high-risk HPV types that could potentially cause cervical cancer. It's often done alongside a Pap smear or sometimes as a follow-up to abnormal Pap results. Knowing the purpose of the test helps you understand why your doctor ordered it and what the results might mean for your next steps in healthcare. When you receive your lab report, the results section is usually clearly labeled. It may be titled HPV results, test results, or something similar. This section will tell you whether high-risk HPV DNA was detected in your sample. It's important to locate this section first, as it contains the most critical information about your test outcome. The most important part of your HPV lab report is whether the virus was detected. If your report says not detected, it means no high-risk HPV types were found in your sample, which is good news. If it says detected, it means high-risk HPV DNA was found, and your doctor may recommend further testing or follow-up. These terms are standard and easy to spot on your report. HPV tests usually focus on high-risk types, as these are linked to cancer. Your report may specify which types were tested for, such as HPV 16 and 18, which are the most dangerous. Low-risk types, which cause warts but not cancer, are generally not included in standard screening. Knowing the difference helps you interpret your results more accurately. If your report mentions HPV 16 or 18, these are specific high-risk types, most commonly linked to cervical cancer. The report may indicate if either of these types was detected. If so, your doctor will likely recommend closer monitoring or additional tests, as these types carry a higher risk. Besides HPV 16 and 18, there are other high-risk HPV types that your test may screen for. Your report might list these as other high-risk types or by their specific numbers. If any of these are detected, your doctor will discuss what that means for your health and whether you need further testing. Lab reports often include a reference range or normal range column. For HPV tests, this usually means not detected is considered normal. If your result falls outside this range, it means HPV was found. This helps you quickly see if your result is within the expected healthy range. Your lab report may mention the method used for the HPV test, such as PCR, polymerase, chain reaction, or DNA hybridization. These methods are highly sensitive and accurate for detecting HPV DNA. Knowing the method can help you understand the reliability of your results, though for most people, the main concern is simply whether HPV was detected. Every lab report includes a section about your sample. This usually lists the type of sample collected, such as a cervical swab, and the date it was taken. This information helps ensure the report matches your test and is important for your medical records. The top of your lab report will usually have your personal details, such as your name, date of birth, and patient ID. Double-check this information to make sure the report is yours. Accurate patient information is essential for proper diagnosis and treatment. Your lab report will also include information about the ordering physician or healthcare provider. This section lists the doctor's name and contact details, which is useful if you have questions about your results or need to discuss next steps. The lab report will have details about the laboratory that performed the test. This includes the lab's name, address, and sometimes accreditation information. This section is important for record keeping and verifying the credibility of your test results. Your report will show the date and time the test was performed and when the report was generated. This helps you track when the sample was collected and how quickly the results were processed. Timely results are important for follow-up care. The summary section of your report gives a quick overview of your HPV test results. This is usually a simple statement like HPV not detected or HPV detected. It's designed to be easy to read and understand at a glance, so you know your status right away. Some reports include a more detailed breakdown listing each HPV type tested for and whether it was detected. This section may use a table format, making it easy to see which types were checked and the outcome for each. If any high-risk types are detected, they'll be clearly marked. Many lab reports include an interpretation or comment section. Here, the lab may explain what your results mean in plain language. For example, they might say, "No high-risk HPV detected. Routine screening recommended." This section helps you understand the next steps and the significance of your results. If your report says HPV is detected, don't panic. This doesn't mean you have cancer. It means you have a high-risk HPV type, and your doctor may recommend further testing, such as a pap smear or colposcopy, to check for abnormal cells. Most HPV infections clear on their own, but follow-up is important for your health. If your report says HPV is not detected, that's great news. It means no high-risk HPV types were found in your sample. You should continue with routine screening as recommended by your healthcare provider. Regular testing is key to staying healthy. Sometimes a lab report may say the result is inconclusive or invalid. This means the test couldn't determine if HPV was present, possibly due to an insufficient sample. Your doctor may recommend repeating the test to get a clear result. A pap smear is a screening test that checks for abnormal cells in the cervix. It's often done at the same time as an HPV test. If your HPV test is positive, your doctor may use the pap smear results to decide if further investigation is needed. It's important to know the difference between an HPV test and a pap smear. The HPV test looks for the virus itself, while the pap smear looks for changes in cervical cells. Both tests are important for cervical cancer screening, and your report may include results from both. HPV testing is usually recommended for women over 30 or for younger women with abnormal pap results. This is because HPV infections are common in younger women and often clear up on their own. Screening guidelines may vary by country, so always follow your doctor's advice. How often you need an HPV test depends on your age, health, history, and previous results. Most guidelines suggest testing every 3 to 5 years if results are normal. Your doctor will recommend the best schedule for you based on your individual risk factors. Most HPV infections don't cause symptoms, but if you notice unusual bleeding, pain, or discharge, let your doctor know. These symptoms may require additional tests, even if your HPV result is negative. Always report new or concerning symptoms promptly. While HPV testing is mainly for women, men can also be affected by HPV. There's currently no routine HPV screening for men, but they can carry and transmit the virus. If you have concerns, talk to your healthcare provider about risk and prevention. Vaccination is a powerful tool for preventing HPV infection. The HPV vaccine protects against the most common high-risk types, including 16 and 18. Even if you're vaccinated, regular screening is still important, as the vaccine doesn't cover all types. Persistent infection with high-risk HPV types can increase your risk for cervical and other cancers. Early detection through testing and regular screening is the best way to prevent cancer. Your lab report helps you and your doctor assess your risk and plan next steps. After reviewing your lab report, schedule a follow-up with your doctor to discuss the results. Bring your report with you and ask any questions you have. Your doctor can explain what the results mean for your health and recommend any necessary next steps. Your HPV test results are confidential and protected by law. Only you and your healthcare provider have access to your lab report. If you have concerns about privacy, talk to your doctor or the lab about how your information is handled. Lab reports use specific terms like positive, negative, detected, not detected, and inconclusive. Understanding these terms helps you interpret your results correctly. If you see unfamiliar words, ask your doctor for clarification. A typical HPV lab report is organized into sections: patient info, sample info, test results, interpretation, and lab details. Familiarizing yourself with this layout makes it easier to find the information you need quickly and accurately. Let's look at an example. If your report says HPV not detected, it means no high-risk HPV was found. The reference range will also say not detected. This is the most common and reassuring result, indicating low risk for cervical cancer at this time. If your report says HPV detected, it means a high-risk type was found. The report may specify which type, such as 16 or 18. Your doctor will explain what this means for your health and may recommend further tests or more frequent screening. An inconclusive result means the test couldn't determine if HPV was present. This might happen if the sample was too small or contaminated. Your doctor will likely recommend repeating the test to get a clear answer. After reviewing your HPV lab report, take note of your results and any recommendations. Schedule a follow-up with your doctor if needed, and keep a copy of your report for your records. Staying organized helps you manage your health effectively. If your result is positive or inconclusive, your doctor may suggest repeating the test in a few months. This helps check if the infection has cleared or if further action is needed. Always follow your doctor's recommendations for repeat testing. Getting an HPV test result can be stressful. Remember, HPV is very common, and most infections clear up on their own. If you feel anxious or worried, talk to your doctor or a counselor for support. You're not alone, and help is available. Preventing HPV involves vaccination, safe sex practices, and regular screening. Using condoms, limiting the number of sexual partners, and getting vaccinated can all reduce your risk. Staying informed and proactive is the best way to protect your health. If you have questions or concerns about your HPV lab report, or if you experience symptoms like bleeding or pain, contact your healthcare provider. Early intervention is important for your health and peace of mind. To sum up, reading an HPV lab report involves checking for detected or not detected results, understanding what high-risk types mean, and following up with your doctor as needed. Keep your report for your records and stay proactive about your health. If you want to learn more about HPV, lab tests, or cervical cancer screening, there are many reliable resources available. Ask your doctor for recommendations or visit trusted health websites for up-to-date information. Understanding your HPV lab report empowers you to take charge of your health. Remember, regular screening and open communication with your healthcare provider are the best ways to stay healthy. Don't hesitate to ask questions and seek support when needed. Thank you for joining us on this guide to reading your HPV lab report. We hope you feel more confident and informed about your results. Remember, knowledge is power when it comes to your health. Stay proactive and take care.